Hello and welcome to another edition of the program Healthguide. I am Fauziya Lukman. We are here to bring you up to date on healthcare, health lifestyle, diseases, precaution, possible treatment, and where to go searching. That is what the program is centered on, and you are watching us on Global TV channel 276 on Star Times. You can follow us on our social medias on Global TV NG. Now, healthy teeth and gum is what every human being, and I mean every human being, dreams of having. And it is the job of a dentist to make us that dream come true. With me in the studio today is a dentist, or as I call him, a dental surgeon. I just like calling him that because it gives it this high tension of being a dentist. In person of Dr. Williams Jonah. Dr. Williams Jonah, welcome to the show.
Thank you.
Thank
Hello.
you so much for joining us.
Thank you.
How has your journey been coming here?
Okay, it was fine. We thank God.
Okay. Dr. Jonah,
Uh,
going straight to the point,
okay.
what is important about being a dentist? What is it about?
Okay. Being a dentist, or let me say dental professional, is that aspect of medicine where professionals are taught how to take care of your teeth, your gums, and your mouth in general. It is very important in the sense that there is this common adage that said the mouth is the entry to the human body. And then oral health is very important because when you talk, the first thing people see is your teeth. When you smile, the first thing people see also is your teeth. So your confidence and everything depends on this aspect of medicine.
Why do you say confidence? Like, I have brown teeth, or yellow teeth, or green teeth.
Okay.
I shouldn't showcase it and just smile at you like this?
Well, as you said, confidence. When you talk, when you smile, if your teeth is yellow, or if it is broken or badly damaged, that gives an impression of you to the society. People will even think, this one cannot take care of his mouth. This person's mouth is dirty. And then when your teeth is brownish or dirty, it gives you bad breath. When you talk, people close their mouth. That certainly will damage your confidence. It would.
My people, you've heard. That will damage your confidence. And that is why today, exclusively, we'll be talking about dental care. I had to wait for him to say it so you will get the idea, because it's Healthguide. We are guiding you, and I want to believe that you're following us back to back and getting enlightened, just like me. But then, Dr. Williams, you said something now.
Yeah?
About mouth odor.
Yes.
When people smile or talk, they perceive mouth odor.
Okay.
Now, this mouth odor, is it something from birth, or you can just pick it along the way?
Okay. Mouth odor, I doubt if there are cases where someone can actually pick it from birth. I think it's along the way. And it's one of the most commonest, let me say, conditions that the general public is actually disturbed about, where when you're in the clinic, you see plenty people coming into the clinic complaining, okay, doctor, my mouth is smelling. My wife told me my mouth is smelling. My colleagues at work, when I talk, they say my mouth is smelling and they are closing their nose. You actually get that along the way. I can't say at birth. Presumably, most times it's because people have bad oral health hygiene practices, where there are deposits of foods. We call it plaque. As you eat, whether you, even if you brush per se, there are some particles of food that you can never remove. So as time goes on, as they get deposited in the tooth and the supporting tissues of the mouth, it predisposes someone to having bad breath, otherwise known as, it's commonly known as halitosis.
Halitosis.
Yeah.
Okay. Now, doctor,
Yeah.
you said something earlier about white teeth, brown teeth, and all of that.
Okay.
Is it that some people just get brown teeth? Because I don't know, I kind of noticed that sometimes you will see some people, especially dark persons,
Okay.
they have this shiny white teeth. Oh my God, like whenever I see that white teeth, I just can't stop myself from staring like, God, please. Is there a particular thing to it, or is it that everybody can have a white teeth and one should be concerned when your teeth start getting faded or like having this yellowish pattern?
No, it's actually, I can say it's genetic. Some people are just born with white teeth. More importantly, as you've mentioned, dark-skinned individuals just have white teeth. And then it should be a concern to you if you have white teeth and with time it's becoming brown, or it's becoming dark. It will be a concern to you. But there are some people that have, on a normal basis, they have dark teeth, or let's say brownish teeth, due to where they grew. Let me give you a simple example. From my place in southern Gombe, if you go to Kaltungo, you see people with stains, brown teeth. That's because of the water they take. It has high fluoride levels. Same thing if you go to places like Maiduguri too, you see people with brownish teeth. And when you see them, those ones, they don't even care. They don't even bother because it's basically what's obtainable there. Almost
majority of the
people there
so
have
it's like
it.
a normal thing.
It's like a normal thing. But let's say as an individual, you have white teeth, and then with time your teeth starts becoming discolored. It's actually a cause for concern, and then you should see a dentist to have it properly checked. Yeah.
Okay. Now, a lot of Africans, I would love to say Africans, not Nigeria per se,
Okay.
because we have this perception
Okay.
that just because my teeth is getting darker, I just need to use a better toothbrush or toothpaste and all of that, because it is said that some toothpaste gives you this fading effect and some gives you the nice effect. Is it that there are toothpaste that are organic, chemically infused, or with some kind of herbs and all of that?
Okay. Basically about toothpastes, there are no toothpastes that can actually give you white teeth. They can actually maintain that whiteness. That is it. And then for toothpaste, the component of toothpaste that is very important is just fluoride. When a toothpaste contains fluoride, that's what is just needed. It makes the teeth strong and resistant to decay. That is why they say brush in the morning and in the night. There are some toothpaste in the let's say in the market per se, that manufacturers will tell you, okay, yes, this toothpaste will make your teeth white, but they don't make your teeth white. They can only maintain that whiteness. If your teeth is white, it will maintain that whiteness. Or if you have undergone whitening, let's say you go to a dentist, your teeth is dark or is yellowish and you want it to be white, and after the treatment, they prescribe those toothpastes. They maintain it. There are plenty toothpastes in the market, but the most important thing is if it contains a fluoride. For whitening your teeth, it goes beyond toothpaste actually.
Okay. So when should one be concerned when their teeth start deviating from being white to another color? Because I could say yellow and then they'll be like, no, it's not yellowish, it's a bit brownish. Or I could say it's brownish and then it's just yellowish. But I just feel when it changes color, should one be concerned, and who does that person go to when they have concerns?
Okay, yeah, when it's changed color from its basic color, yeah, you know your teeth is white, and then with time, when you look at the mirror, you notice it has started darkening or becoming yellowish. You go to a dentist, you go to a professional dentist, or sometimes you can go to a dental therapist too. They do whitening, and there they will determine whether, okay, this yellowish discoloration of your teeth, or dark, or any color, is it extrinsic or intrinsic? It's just English per se. Extrinsic is just outside. Intrinsic is it inside the tooth. For discoloration that is inside the tooth, you will have to undergo some treatment, of course, which I will give you options subsequently. You undergo treatment, whitening per se, and then sometimes it's not even because when a teeth is discolored or is brown or anything, it is not because how can I put it? Sometimes there's a problem with that specific tooth. It might be decay from inside. It might be decay from inside that is causing that discoloration. So you undergo treatment to take care of that. If it is outside the tooth, sometimes routine cleanings, we call it scaling and polishing. I know it's very common. You will hear it frequently if you are conversant with dentistry. Scaling and polishing, routine cleanings will take care of that.
My people, I hope you've been following us and hearing. Dr. Williams here said something very, very catchy. If you missed it, I had we all covered. But before then, we'll go on a little short break. When we come back, I'll give you the surprise. Welcome back. A little reminder, you are watching us on Global TV channel 276 on Star Time, and again, you can follow us across all our social media platforms on Global TV NG. I am still Fauziya Lukman. Before the break, Dr. Williams said something about dental health and therapy. I know you missed that. Me too, but I got you covered. Dr. Williams, please tell us, what is the difference between seeing a dentist and then the dental therapy?
Okay. The dentist per se, both the two are dental professionals per se, but the job description is a bit different. Dentists, or otherwise dental surgeons, go to dental school for 6 years here in Nigeria, and then once when they graduate, they undergo internship, where I don't want to use medical terms per se. They are both dental professionals, but their job description differ. A dentist do take history, do examinations, and provide treatment to toothache and other conditions that disturb the mouth. Dental therapists per se do routine cleanings, do whitenings, and also they do children's dentistry, like fluorides, application of fluoride to the tooth to make it stronger. Okay. Then oral health.
You can use the, science word and the dentist word. All you have to do is just explain it for us on lame times, because we're all about enlightening.
Okay.
Now, does that mean I need to go for a dentist therapy before visiting a dentist, or just dentist therapy is just enough?
Okay, no, you go to a dental, you go to a dentist, a dental surgeon otherwise. When the dental surgeons take your history, when he asks you about what is disturbing you, you give him history, he does examinations, and if he feels you will benefit from the dental therapist, let's say for routine cleaning, scaling and polishing, he refers you to the dental therapist in the practice to do the cleaning. If you need fluoride supplements too, if you need, let's say, whitening. Yeah.
Okay. Now, some people take chocolate.
Okay.
I was guilty of that.
Everybody is guilty.
And there's this addiction that comes with taking chocolate.
Okay.
And for some reason, I kind of noticed that when people that have addiction to chocolate, their teeth are always brownish.
Yeah.
Is there a thing to that, like, and does it affect the teeth, like the sharpness or the strength or the chewing ability?
Okay. Chocolates are sugars. Let me say refined carbohydrates. In fact, they are the most important factor in tooth decay, which is very common. Chocolate, soft drinks, anything that contains refined carbohydrates, sugars, dietary sugars, they damage the teeth. Over time, although it needs time to develop. They produce, as you take chocolates, in between brushing or in between rinsing your mouth, the bacteria in your mouth. Our mouth has what we call bacteria, and it is quite there. We call it normal flora. It is there in your body. It doesn't cause anything. It is just there. But then, when you don't brush your teeth, when you don't do your oral hygiene practices very well, and you take chocolate, you take refined carbohydrates, sugars, dietary sugars, sweets, chewing gums, and all those things, these bacteria acts on these sugars. And then the byproducts, when they act on this, damage the teeth. It's the most commonest cause of tooth decay. We call it dental caries, and it's one of the most commonest diseases, not in dentistry alone, in medicine completely. It's one of the most commonest diseases, and it's very rampant from childhood too. It's one of the most commonest cause of tooth loss.
Okay.
Yeah.
The thing is, people have adapted a lot of things
Okay.
into cleaning their teeth.
Okay.
Some use this chewing stick,
Okay.
some use this charcoal,
Okay.
while others use mouthwash.
Okay.
Like, I don't know, for some reason, I just feel mouthwash is quite heavy. And the whole gargling and all the like that. So, which one would you say is more advanced and acceptable as a dentist?
Okay. The FDI, that's the International Body for Dentists, WHO, all advocate for individuals to use toothbrush. Toothbrush is a medium texture toothbrush and a fluoride containing toothpaste to brush 2 times daily. Then floss. There's this thing we call dental floss, which is just like a thread. You use that, and then one thing with oral hygiene, one is not a substitute for the other.
Okay.
Dental floss is not a substitute for toothbrush. Toothbrush is not a substitute for dental floss. Toothbrush and toothpaste is not a substitute for mouthwash. You all do this thing in unison. You do them concurrently. Let's say you use mouthwash twice a week. It's not what you will even use daily, every day. No. You use it, let's say, twice a week. But for toothbrush, it is very important you brush in the morning and last thing before you sleep.
Did you say mouthwash should be used when? Can
Just,
you repeat it?
you don't use mouthwash daily. Yeah, it's not something you use daily. You can use it, let's say, 2-3 times a week.
You heard that. You can't use mouthwash daily. Remember, you had it here on Global TV, on Healthguide. You can't do that. Do you know, I used to be a victim of that.
We all used to be.
I used to use mouthwash every single day at bedtime. I feel, okay, all I have to do is brush my teeth in the morning and then use the mouthwash at
in the
night
evening.
when I'm going to bed. And then it's the perfect hygiene I'm practicing.
Wow.
So that means I've been doing it wrong?
Yeah, you've been doing it wrong. You see, like I said earlier, you can't use one as a substitute for the other. Let's take toothbrush, for example. In fact, it's even more important in the night to brush. You understand? It's very, very important, because for tooth decay to occur, it needs time. The interval when you sleep, let's say you sleep by 10 p.m., the interval when you sleep between 10 p.m. to 6 a.m. or 7 before you brush your teeth is a very long period of time. So when you take refined carbohydrates or other things that damage the teeth, this gives it ample time for the bacteria in your mouth to act. So that's why one is never a substitute for the other. You have to do everything in combination, and then that's what you can do on your own as an individual to take care of your oral health. Every six months also, you see a dentist.
Okay. So you said something about teeth whitening.
Okay.
Is that something you do every six months, as you earlier mentioned a minute ago, or is that something you do when you notice your teeth is becoming dark or anything? And then the whitening, does it help the teeth, and what does it do to the teeth?
Okay. Whitening is not what you do every six months per se. I understand what you meant. I think it should be scaling and polishing. Scaling and polishing is what you do every six months.
Okay, so there's a difference between
Yes,
scaling
there's
and
difference
polishing
between
and
scaling and polishing and whitening. Let me just shed more light into it. Scaling and polishing is when you remove the deposits on your tooth. When we eat over time, we have what we call plaque deposits. It's a combination of saliva, some proteins and other things, debris of the food we eat, and dead cells, dead bacteria in your mouth. They attach to the surface of the teeth. So you have to take that out every 6 months, or else they predispose your teeth to decay. Not even decay alone. You will notice some people have bleeding gums. When they brush, they will tell you, I've been seeing blood in my
coming out.
The supporting tissues of the gums are inflamed, and this deposit is what is the culprit. Okay. Yeah, it damages the gums.
So when your teeth start bringing out the blood,
yes,
you need to go for the...
Yeah, you need to go for scaling and polishing, and then you will be assessed. We call it, the person is having gingivitis, just like inflammation of your gums. Then whitening is a cosmetic procedure, and you only do it when there's a need for it, actually. Scaling and polishing, you do it every six months, at least once a year.
Okay.
Yeah.
So does it mean that once I get to the hospital, all I have to do is tell them I want to go for scaling and polishing, or is it that there's a particular place I have to go to, or then what do I do if I want to do it?
Okay, when you go to a dentist, you just tell them you are here for your routine checkup. We just call it routine checkup. And when you come for your routine checkup, you will definitely have that scaling and polishing. It is part of the protocols. Every six months, even when you don't have toothache, when you don't have bleeding gums, when you don't have mouth odor, you don't have anything wrong with your mouth. I know it's actually difficult when you don't have, as Africans per se, or Nigerians, we don't have that habit of going to the hospital. They will say, I am doing okay, what's the point of going there? But it's actually important. You prevent, let's say, the world have moved on from curative aspects of, you prevent those things. If they say sugars, too much sugars, take diabetes, you prevent them. If they say too much sugars damage your teeth, you prevent them. So going to that dentist every 6 months is a preventive strategy on its own. Because when they notice decay, they will tell you, okay, this tooth has started decaying, let's take care of it before it gets bad. Okay, this teeth, the gums here, they are inflamed, let's take care of it before it gets bad. And then it saves you more stress, more pain in the future, you save more money and everything.
Let's talk to decay.
Okay, decay.
For some reasons, Nigerians feel whenever I say I have tooth decay, they tell me, go and remove the teeth. Go and remove the teeth.
Okay.
What is the mystery behind that? And then what do you do when you start experiencing tooth decay?
Okay. When you start having tooth decay, when it's at its early stages, you don't have pain. So when you go to the hospital, you just have that teeth filled. There's no point in removing your teeth. But when you notice the decay and it's there, taking months, taking years, you didn't seek attention for it, it gets badly damaged. And in that, there's nothing they can do. They will just have to extract the teeth. But all efforts as individuals, all our efforts when it comes to oral health should be, preventive. Let's avoid those things that will lead to tooth decay or tooth loss in the first place. Because once when the tooth is decayed and it's badly damaged, we don't have option than to remove it. And then tooth loss is an entire spectrum on its own. It's actually not good.
Yeah. There's a way to make someone look somehow,
yeah.
I don't want to say ugly, but a bit less attractive. So that's when the need for the whole filling comes in, right?
Yeah, you do a filling. When the teeth is decayed, you do a filling. And when you start having pain, that means it must have gone inside.
Okay.
Must have gone inside the tooth. That's why you're having pain. In that regards, we have other treatments, modalities like, we call it root canal treatment, where you go from inside, remove the infection that is inside the tooth. Afterward, you you do a filling on it.
Okay.
Yeah.
So lastly,
Okay.
is there anything you would like to tell our viewers concerning decay, teeth,
Okay.
seeing a dentist, going to hospital, and what to do?
Okay. As a society, we should put more effort on our oral health. Oral health is very integral as just our general health. We should have this habit of seeing the dentist every 6 months if we don't have issues, even if we don't have oral health concerns. And then once when we notice any changes in our mouth, we go see a dentist. And then don't forget, please, your brushing is very important. The use of a toothpaste and yes, a fluoride containing toothpaste, and your toothbrush, brushing 2 times daily, in the morning, in the evening, using mouth floss, and then occasionally using mouthwash is very important for optimum oral health. People say the mouth, as I've said when we started this program, the mouth is the gateway to the body, and it says much about you as an individual when you take care of your oral health.
Well, that's it. Today, you've learned a lot. I've learned a lot. We've learned a lot. Now, when I smile, I know that I have every reason to smile because I have seen a dentist, I've talked to a dentist, and I know much more about dental care. How would I have known that? Except if I have been watching Global TV and the program Health Guide. If you love this program, please drop a comment below and tell us what next you think we should talk about. What have you been curious about, what you want to know, and where you want to go finding answers. See you again same time next week. Bye.